Okay, so June psychiatrist Pakistan. Okay. Dear Dr. Jones, okay, not M. Jones. Dear Dr. Jones, Catherine Walter, okay, date of birth. I'm writing to urgently refer Mrs. Walter, who has features of depression and bipolar disorders. There are 50, 60 bipolar disorders, you know. There is only a bipolar disorder, and this bipolar, if I, according to me, if I'm not wrong, uh, correct me if I'm wrong in terms of medical knowledge, because I'm not a psychiatrist, so I can be wrong. But it's, as I know, there are, I guess, two types of bipolar disorders, like bipolar affective disorder, and there was one another. If I remember, there was a mood pendulum given on the book. Okay, it's long. It's a long story. It's been years now. Okay, so whatsoever, depression and bipolar disorder. That's it. With the thoughts of suicide. Okay, with suicidal ideation would be better. Okay, for further. Okay, so why you have to write for further? See, you have started from now. Dr. Wafa, yesterday I told you the sentences are baby. Today they are very lengthy. I mean, you have even forgot the, you should have ended your sentence over here to suicide, and then you could have started the next sentence. Your further assessment and management would be highly appreciated, rather than writing single sentence. Okay? I'm not saying write a sentence of 50 lines. I'm just saying write a sentence which is compound and comprehensive. Okay. And the comprehensive means it should be not very long and it should not be very short. Okay. A moderate level of sentence. Okay. So if I were you, I would have written this way. I'm writing to Ajamida from Mrs. Walter, who has features suggestive of depression and bipolar disorder, along with suicidal ideation. Your further assessment and management in this regard will be highly appreciated. Okay, so this is a compound way of writing the subject. Okay, okay. Now there can be just give you an example. Do you think there may be many days in today? Today is a single day, right? So it can't be today's. Okay, like it's not plural. Today is a single day. So just write today. There should be no s. If you have to write like today's Mrs. Walter, then add on today's visit. Mrs. Walter has presented. Okay, I hope you're getting my point. Presented with the complaint of shyness. Okay, not complain. Okay, see, if you write complain, then it is only tiredness and your sentence should be completed well. But if you see there are many things that you're writing, so write complaints. This S is quite a problematic, I guess. Okay, so you are using this S at a wrong place. Today, Mrs. Walter has presented with the complaints of tiredness. Okay, sleeps badly. See, sleeps badly is not a good way to write, like poor sleep. And she wants to die as she is unable to cope, okay, with the lack of energy to complete. Okay, and that's it. You can end your sentence. Okay, till coping or cope. Then you can write. She also has complained that she is unable to do her household tasks because of low energy levels. Okay, she feels overwhelmed with responsibilities and does not want to eat anything. Okay, this is, I'm just explaining one by one, okay, line by line, word by word. Okay, She is vitally stable and normal on physical. Okay, see, if she is vitally stable and examination is normal, that's right. Her physical examination is unremarkable. That's nothing else. Everything comes in that, vitals and this and that will come in that. Okay. On this stage, Mrs. Walter came for checkup in my clinic. She had asthmatic attacks this year, but at that time it was controlled and had fungus on the teeth, which flares up periodically, and low cream seemed to be effective. She was widely stable and recommended Niconazole. Who recommended? She was widely stable, so she herself recommended Niconazole to her. No. Okay. Mention that you recommended. She was widely stable. Therefore, okay, and you are not recommending something, you are prescribing it. Okay, patient has to take it so that he can feel better. She can feel better, right? Right that. She was widely stable, and therefore Miconazole was prescribed. Okay. I'm just telling you the sentence, although this paragraph is not well written, this is irrelevant information that you have written over here. She was advised to change her lifestyle, to decrease weight and increase exercise. Because Graham gets on this day, Mrs. Walter was feeling well and energetic, and her asthmatic attacks cleared up about 2 months ago, but no attacks since then. She had normal BMI and physical examination. Mrs. Walter had a history of asthma and chronic fungal infection, for which she was taking budesonide inhaler and clotrimazole, and had a history of depression. Given the above, I would be very grateful to you for further assessment and management. Okay, if you have any queries, please contact me. You are sincerely, Doctor. Okay, Dr. Wafa, let's give you an example now. Okay, whom are we going to? Okay, let's just see someone else is better as well. Okay, then we will discuss. Uh, Dr. Wafa, you have to improve. Okay, a lot. Not in terms of English skills. English skills are somehow fine. Problem with the structure of the lecture. I'll definitely come on to that one. Just give me a few minutes. Okay, Dr. Sar, I hope you are here. Here, Dr. Jones, Captain Walter. Okay, I'm writing turning you up from Mrs. Walter into your care for assessment. And treatment of depression. Never add the slash over here. Write OR word. OR. Depression or depression and bipolar disorder and suicidal thoughts. Today, Mrs. Walter reports in the clinic with feelings of not coping and of wanting to die. She is tired but sleeps a lot. Mrs. Walter, no, not Mrs. This is something I mentioned yesterday. She has no energy to complete her household tasks and looking after her children. Her examination is unremarkable. On this stage, Mrs. Walter came into the clinic for checkup. She was happy but complained of being tired. She was overweight as well. Her blood pressure and heart was normal. Her weight was 82 kilograms and BMI was 28.4. Pathology ordered. Okay, pathology ordered what? What ordered? Was pap smear and CBC. Okay. Therefore, pap smear and CBC were ordered. Okay. Mrs. Walter was advised for lifestyle changes to reduce weight. Patient, is that right? Is it patient word? Patient to be informed for test results in 1 week by phone. Very nice. Okay, this was really a terrible sentence, I would say. Okay, this actually is really hurting this patient. There is no patient in OET. You will never ever encounter a word called patient in the whole OET letter writing. Okay, and you will never inform anyone on the phone. Okay, this sentence could have skipped completely. Okay, but we have messed up here. On this date, Mrs. Walter came into the clinic with feeling of feeling well and energetic. She had lost weight by joining gym. Her weight was this and BMI was this. That's the right one. Mr. Walter had asthma in childhood on inhaler. Okay, so uh, if I translate this sentence for you, Dr. Sarah, it would be like this: that her asthma is sitting on her inhaler. Okay, like Mrs. Walter has asthma since childhood on inhaler. Okay, like she has asthma since childhood, and her asthma or maybe her childhood is sitting on her inhaler. Since 26/6/1999, she has chronic fungal infection, both feet and currently using clotimazole. She has family history with cutting. First thing is, see, it took a lot of effort for me to read this letter. The first thing is the picture is not clear. Other thing is that we have written everything in a way like everything is merged. So many cuttings are there. Definitely, the presentation is really poor. Okay, really poor presentation. The second, if you write this way, even though you will write a good letter, still you won't get a score. Why? Because there is no proper organization. Like, I'm not saying the letter organization is wrong, I'm saying the maintenance of the letter that you have written. So there should be, you should spare one line of the register, okay, and it's completely fine. There should be no cutting, okay. And if you guys can do it, write your letters on the official OET page. Okay, if it's possible. If not, then definitely you can write on the paper as well. So please do write proper letters so that I will not waste my time and yours at the same time. Now let's come to the letter. My point of view is this is overall a good letter. Okay, there are some mistakes. The good thing is that you have written a letter in a way that you knew that you're writing a letter to psychologists or psychiatrists. Okay, what Dr. Wafa has done, she has had to actually write a letter to psychiatrists, but she somehow was writing a letter to dermatologists, a general medicine specialist or maybe pulmonologist and a psychiatrist at the same time. Okay, so I don't know who will get that. I'll come to that. Okay, how you should know that. Okay, so that's the reason here. Okay, explain the point so that you guys can, you know, you guys will even try to make the mistake, but you will not be able to. Okay, the next thing is about your letter, Dr. Sarah. To see your letter, I was talking about this paragraph. the last one is extremely poorly written. I cannot, show my exact emotion while reading these 4 5 lines. Okay. So how would you have written this paragraph? Listen, Mrs. Walter has been diagnosed with asthma since her childhood, for which she takes budesonide inhaler. That's it. This is a sentence. This is how you have to write. Please note, she also has a chronic fungal infection for which she uses or for which she uh, you know uses clotrimazole, or for which she takes regular medication. The most important thing was about depression, because you're writing a letter to psychiatrist. So the first and the foremost thing that you should have mentioned is the depression. Please note, Mrs. Walter's family history is positive for depression. She also has been diagnosed with chronic fungal infection and asthma, okay, for which she takes regular medication. That's it, nothing else. 2.5 lines, done and dusted. In view of the above, I would be grateful if you could further assess and manage Mrs. Walter's condition accordingly. Yours sincerely, Doctor. And in yours, there is no apostrophe. YOURS. There is no apostrophe over here. Okay, I hope I am clear. See, Dr. Wafa, whatever the sentence you have to use, go and use it. See, I have no problem with your sentence things. Just remember one thing: whenever you're writing the past visit, write them in the past. Otherwise, whatever you write, you want to write it. I have no problem. I won't emphasize on that. Why? Because if I'll emphasize, you'll make mistakes. Right now, my main focus is not to correct your tense mistakes. The grammar we will talk about. The first and the foremost thing is the organization, the relevant information. Problem is that we have not written the relevant information. I'll come to that. Let me just see Dr. Shahid. I'm writing to Anthony Refer, Mrs. Walter, whose features are suggestive of severe depression. Why would you write including suicidal thoughts in the property? Why? See, did I tell you anywhere that you have to write anything exactly when you're writing your property? Just simply write including suicidal thoughts, okay, and bipolar disorder. Your further assessment and management will get great. On today's consultation, Mrs. Catherine, not Mrs. Catherine, please. If it is Mrs., then why would it be Catherine? It's Walter. Mrs. Walter presented with the complaints of tiredness and sleep, bad sleep, lack of appetite, lack of energy to complete household tasks, including cooking. See, household task means everything. Okay, if I am a woman and you will tell me that you are unable to do your household task, I will eventually get it. That I'm unable to clean, unable to cook. These are the household tasks, right? We cannot run you know, maybe a restaurant in the house. You can if you're working on the cloud system, but you cannot have a rugby match in the house. That is not a household task, right? So you have to understand when you write household task, it is completely understandable. Okay, that's just leave everything else is secondary now. Okay, if you want to specify, then don't write household task. She reported feelings of not coping and of wanting to die, along with she feels overwhelmed with responsibilities. Her vital signs and examination, including BMI, are unacceptable. provisional diagnosis of severity. See, you don't need to write provisional diagnosis this time because you have already written this thing in where? In the purpose. So this 1.5 line and the previous 1 line, you have added something which is irrelevant, which could have been skipped. Okay, so you will definitely lose your score. Mrs. Walter came to me for regular checkup. She reported of feeling tired and her asthma was controlled. However, she was having more attacks this year. She seemed and she did not volunteer. See, I am completely unable to understand what you have written over there. Okay? This is what I called a mess. Now, why the send an examination were on the except he was overweight, he was advised to change his lifestyle, reduce weight, and do exercise. The relevant investigation were ordered. Okay, just copy paste. We have just copy pasted everything. Okay. On subsequent visit, Mrs. Walter reported of feeling well and stated that she was too busy to come and schedule the appointment and did not think it was necessary. Her involvement with school was increased and now she was not now and she was president of Parents Association. She lost weight and Jim, what is that? Her blood pressure was wrong. It's normal, just write normal. Harder is normal. Yes, it's again 2.5 lines you have wasted. Okay. Mrs. Walter has been diagnosed with asthma since childhood and she has chronic fungal infection. Her current medication includes Pulmicort and chlorpheniramine cream. She has no hobbies. Very good. Just write everything. Yes, yes, yes. Okay, see, if you see now, what do you think? What would be the word count? What would be the word count? Do you think it is in the word count range 200 or 180? No, it's definitely more than that. You can count, and I'm not even counting the small things that you mentioned over here. It's a huge letter. Okay, so you just have added everything that you have seen. So these 2.5 lines could have been skipped. Then this her like hobbies and things could have been skipped. Okay, important thing was depression. Okay, you could have easily skipped the medication as well if you want to. This weight and this and that was if there was any not significant, you could have skipped that thing as well. Okay, then this visit, this could have been a lot improved a lot. Okay, and then these 2.5 lines could have been skipped from her vital signs till has been made. Okay, 4 lines, I would say 3.5 or 4 lines. Okay, could have been skipped. So if you all in all, if you see 3 lines from here, about 3 lines from here, 6, then 3 from here, 9, about 10 to 12 lines you have written extra. So if you average, if you see that in an average line you are writing 7 words, so 12 into 7. These are the words that we have written extra, and you are going to lose it. See, remember you have to all now. See, let's just come to the point where I was talking about. Overall, if I see Dr. Shaida, this letter was good. Your sentences were quite comprehensive and compounded. The good thing is that with complexity, you were writing them properly. That is very good. The problem is that you have just copy pasted most of it. Now let's just come back to the point how where the things have been, where the things actually were not good. Okay. So the first thing is, remember, this is a letter for all of you. You guys are writing this letter to a psychiatrist. Okay. Now, Dr. Wafa, what you have done, Why I'm saying that we have included dermatologists and the pulmonologists at the same time. Because if you see yourself, this whole page is talking about fungus and asthma. Okay, if I am giving an example, okay, I'm just giving an example. Suppose you are a psychiatrist. Okay. You are sitting in a clinic, in a psychological center or psychiatric clinic. You are watching the patients. A 112 ambulance has arrived with the patient, acute exturbation of asthma. What can you do for the patient? Can you do anything? No. You cannot do anything. You are psychiatrist. What would you say? Please take the patient to nearby emergency department where the oxygen is available, where the proper treatment is available, where patient can have salbutamol, where patient can have either ipratropium bromide, hydrocortisone, okay, the steroids, or maybe something else. Or you are going to stand up and you have to become something, and you start giving the medication. Right? You cannot prescribe alprazolam to asthmatic patient, right? If the patient is there with the excavation. Okay. Same goes with the fungus. If the patient has come to you and say, okay, doctor, I know that you're a psychiatrist, but I have this fungal infection in my right leg or left leg. Okay, and it's been worsening, or I have psoriasis. I want you to treat me. What would you say? Let's just treat you. No, you don't treat that. You will say that go to dermatologist. I cannot treat it because I don't know this condition. Even though I have read this thing in my MBBS degree, but this is not my personal, specialty. I cannot treat it. Apply this core knowledge of your medicine here. You have to write relevant. You cannot write. You are writing a letter to psychiatrist, but you're writing everything about periodic fungal infection, clotrimazole, asthma flare-up, budesonide inhaler. Come on, guys. How can you think that if you write this way, you're gonna pass? No, you won't. Because these things are given there in the letter to make you feel uncomfortable, okay, and to make you, I would say, make you fool. If you are writing that information in your letter, then the OET officials are quite successful in their, in this agenda where they are making you fool. You are in the trap. If you won't, you will pass. You have to be smart enough to get scored, all of you. So see, 12 lines if that Dr. Shaila has written extra. So you are already there in the pit, okay? And you're waiting for for the soil to come in. But don't do that, please. I'm just exaggerating these things a lot. Why? Because I do not want you to waste your money and time. And believe me, at the end of the day, if you try to make a mistake, inshallah, you won't be able to. Because I will go into your brain and tell your brain that this is wrong. And you will be writing a right thing, inshallah. Okay? I hope I am clear. Okay, guys, if it is not, do ask me. I can explain these things to you guys more than 1,000 times. Then believe me, I won't even have any change of my facial expression. I can explain this the whole night to you if you are unable to get my point. Okay, I have no problem. But make these things clear in your mind. Okay, you cannot make these mistakes. These are very basic mistakes. These are organizational, informational, relevant, irrelevant things. Okay, and if you focus, these are the core things. Okay, and these are the basics things that you have to have to remember. If you won't, you will not. Okay, but I won't let you guys do that. Okay, so skip what is irrelevant. See, when I was when I took my OET, and if I'm not wrong, it's been years now, 3 4 years back. Uh, yeah, about 2 years, I'd say three and a half or so. But I don't exactly remember. Okay, so at that particular time, what happened? In my letter, they gave, I had to refer the patient to dermatologist. Okay. There were 6 visits in the whole letter, and they were quite Django or jumbo visits. Out of 6, there were only 2 visits in which they were talking about the dermatology. The previous information, the 4 visits were all about patient, had a fall 10 years ago, femur fracture. After that, had fungal infection. After that, the third visit was about UTI. So many things. The 4 visits were very, very rough, and they were like not making sense at all. I skipped all 4. Simple. I just wrote 2 visits that were relevant. Those 2 visits were relevant. I just added the other information in the history, like the relevant history, definitely. Okay, if the fungal infection was somehow related to dermatology thing, so I added that. Please note she had a fungal infection in this year. Okay, so and a little bit about his social history that he works there. Okay, and he was, I guess, working at the farm that could have been linked with the condition such as the dermatology because of the skin condition and the skin excoriation he was having at that. The relevant information should be mentioned. Alhamdulillah, I got maybe 390 or 400 in the writing, if I'm not wrong. Okay, but of course, that is what is the important thing, right? It's okay to skip something. Do not be worried that if I'll skip something, I will fail. No, if you won't skip, you will fail. If it is not fitting in the letter, leave it. Okay. If they are telling you that, let's just come to this point of diagram. See, in this here, from here you see these lines I'm talking about. Blood pressure is 108/90. What is the actual or average blood pressure reading in a normal person? 120, 110 is the normal. Okay, heart rate was 66. What is the average heart rate? 72. 60 to 100 is the normal. More than 100 techie, less than 60 ready. Right? Investigations were normal. Why are you writing that? No, so when you have written investigations are normal, why are you writing no abnormality was found in our pap smear? Do you think pap smear is not an investigation? It is something else. It's also an investigation, right? There's no need to mention it. Okay? There's no need to mention it. Same goes with the previous 3 lines. If something is normal, leave it. Why you are wasting your time, words, effort? Okay, please keep these things in your mind. I cannot, make it clear more than this. Okay, I hope I am clear and I am making sense. Okay, so yeah. So just do remember these things that I've been explaining from the very first day. Do not make these mistakes. And inshallah, by the grace of Allah, you guys are going to ace your exam. Okay, and you are going to, inshallah, pray a lot. And I want to pray. And I will not let those prayers, go in vain. Okay. I will get my prayers from you guys because I really need them. Okay. And I won't let you guys make the mistakes. And I won't let you guys waste your money and time at the same time. Okay. That's it. This is me signing off. Okay. If you guys have any questions, ask me. I can, answer all of your queries. more than 1,000 times, okay, without even changing any facial expression of mine, okay, and yeah, and things are inshallah going to work. No problem. That's why I'm here, okay. And yes, so just keep doing good things, keep writing good letters, and uh, no problem, though. I hope I am making things, and I hope I'm making things loud and clear, crystal clear for all of you. Okay, so just remember me in your prayers, and thank you so much. Okay, you remember me. You're welcome, Dr. Ofa. Okay, so yeah, so inshallah, I'll see you guys tomorrow. We will talk about the speaking tomorrow. Okay, we will have speaking cards. I will send you guys the card, and we will be practicing the speaking role plays. Okay, you guys are going to be doctors. I am going to be an interlocutor, patient, or a carer maybe, and we will talk one by one. Each of you will have 10 minutes to speak, 5 minutes. We will practice one card, 5 minutes for the card, 3 minutes for the reading, and 2.5 minutes to talk about the feedback. Okay, and that's completely fine if you guys are having some issues, because that's why I'm here. Okay, so that I can correct all the things. So yeah, this is me signing off. Thank you so much. Do remember to be prepared. Allah.